Good afternoon, everybody. Chris Tarabasi here, once again bringing you our annual compliance program presentation. Record? Where's that? This guy. This guy.
Did you push? Okay, just
go. Okay. Thank you, Don. We're here in front of a live studio audience. Say, everybody. Okay, good. And thank you once again for joining us. I'll work through these slides with some pace. Certainly, there is an opportunity to ask questions through the chat room, I believe. So feel free to do that. We'll have some poll questions for you at some point. So please feel free to respond at your location. And without further ado, welcome to the program for this year. So once again, why is this program mandatory? Well, it's the law. We are responsible, and in order to be compliant with the expectations in New York State Department of Health, we're responsible for providing this program to you. Even though you heard it before, it's one of those things. It's not bad to remind us all of how important it is. So we're responsible overall for protecting the finite resources that our taxpayers pay in through the federal and state governments for the health programs that we support as practitioners. The government expects us that we'll use these funds appropriately and legally, and as such, you'll be expected at the end to sign a code of conduct, once again, that just sort of codifies that you are going to comply as well. So goals for today's meeting: review, refamiliarize all of us about our obligations for staff and providers to follow the rules and regulations, to discuss the differences between fraud, waste, and abuse once again, and just basically leave knowing that we're all on the same page, that we have an obligation to protect the funding that we do receive from the government. So every year, billions of dollars are appropriately spent for whatever reason, fraud, waste, and abuse, they call it, and it does affect all of us. We all pay taxes towards this program, and so it's upon us to protect as best we can. It's everyone's responsibility. And so we're gonna work to be vigilant and protect ourselves, protect yourself, protect the practice, protect our patients. Of course, we'd like to think we're compliant. We certainly come to our positions every day doing what we do, but you have to understand that every activity that we do in our practice is subject to retroactive scrutiny by the government. They have the ability to look back years upon things to tell us what we're doing right and not doing right. So for example, if you have extra time on your hand, you can go to this website right here, which is the OMIG website. OMIG stands for Office of Medicaid Inspector General. That's the part of the New York State government that oversees, that sort of is the watchdog of all funding from Medicaid. The federal version is called the OIG, Office of Inspector General. And I don't have slides on that, but it's just as they provide oversight as well on Medicaid, because Medicaid is a state and federal program. The letter you never want to receive is on this left here. This is a letter that was received by a nurse practitioner in February of 2022 for money that they received back in 2017. So the reach can go back years from the government if they think that there's something wrong. In this particular case, this nurse practitioner was found to owe back money for the Meaningful Use program that she was part of. On the right-hand side is a letter that was received by a physician practice in Jamaica, New York. If you're interested, there's the storefront if you want to go visit there. And basically, the government's looking back for $581,000 in monies they said was fraudulently taken from the state government. Once again, these are the letters you never want to receive. Each month, the OMIG comes out with its laundry list of settled cases, and what you're seeing here is the cases from October and September. Do not routinely check this, but this is where you would end up if there ever was a case for which you were found to be having issues. So we're going to talk about fraud, waste, and abuse. And just to review, what's fraud? Fraud is intentional and typically characterized by knowingly submitting false statements or making misrepresentations of fact. It's knowingly soliciting or paying or accepting money to produce or induce rewards for things that you're doing within the program. And it's for making prohibited referrals for certain designated health services. And what that means is if you owned a clinical laboratory and you referred work to your own laboratory, that could be construed as fraud. Now, there's always exceptions, so that when in our offices, when we do work for our own patients within the confines of our office, that's not fraud because it's within your own practice. This would be if you own an outside laboratory. if you were the solo owner of Quest, for example, and you sent all your lab work to Quest and you received remuneration from it, that would be something that would run afoul with the law. Some examples of fraud: knowingly billing for services not furnished, billing for stuff you're not doing, basically, billing more than once for the same service, misrepresenting a diagnosis just to justify payment, falsifying the identity of a provider or service. There are claim mills out there where these nefarious people will get a hold of a physician who has become deceased, and steal the MPI and send out claims under that person's name until they get caught. Then they shut down the mill and they open up another mill. So there are people out there that try to outthink the system and do extract dollars from the government, from us as taxpayers. Billing for appointments for the patient that did not keep. Now that really, with Medicaid, as you know, we cannot bill for no-shows for Medicaid patients. Certainly we can bill for no-shows for commercial type patients, but for Medicaid we cannot. Altering claim forms. Once again, knowingly doing things in order to induce a payment is considered to be in the world of fraud. What about waste? Now, waste is something a little different. Waste is really overusing services, and generally not considered to be criminally negligent, but really it just wastes money. So I try to think this through a bit from our standpoint, from a pediatric standpoint, and I would think one of the things that the office are experiencing right now, maybe you've heard about the amoxicillin shortage. Okay, there's a school of thought that part of the reason why there is a shortage is because we have parents who are insisting that their kid get put on amoxicillin when perhaps they don't need it. In other words, we're sort of conspiring to the patient just to get them out the door. In other cases where providers decide it's just safer to give the kid amoxicillin, and perhaps we're using it more than we should be using it. Another example of waste could be when physicians or providers decide they're going to order something just because they want to be sure that they're covering their bases, that they're going to protect themselves. If something bad happens, they can say that they ordered this test. So really had nothing to do with the clinical care, more just to protect themselves. It's referred to as defensive medicine, and it's a real life thing that's out there. So basically ordering stuff, doing things that aren't necessarily in the best interest of the patient care, just doing it for other reasons. And lastly, abuse. What about abuse? Well, I put up duh. Abuse really talks about things that you thought you were doing correctly. It turns out you weren't doing correctly, and there's no knowingly or intentionally doing something to misrepresent facts. It's more just you thought you were doing something correctly, and you come to find out retroactively you were not doing something correctly. So examples of that: billing for unnecessary medical services, misusing codes on claims, billing for things that should have been bundled that were not, that you unbundled them, improper using modifiers. Modifiers are a big thing, and actually we went through last year, the billing office, and we went through a situation where we had to submit to a chart audit because this particular payer didn't like the way we were using modifiers. So we had to prove our point, and in many more cases than not, show them that we were using them correctly. Nonetheless, that's an example of what can be construed as abuse. And big one for the providers know this all too well. If it wasn't documented, it wasn't done. So lack of medical record documentation to support something is another reason that abuse is out there. Okay, Chris, one more time, what's the diff? Knowledge and intent is the key to knowing whether something is fraudulent or not. And that's what the government would do. And if we ever were under investigation, they would try to work to see if we knew that we were doing something wrong and intended to do something wrong. And if that's the case, and you're charged with found to be fraudulent, that's when you would most likely put on orange clothing and go to jail and pay back a lot of money. So when it comes to how you're punished for this stuff, it could range anything from we take the money back to we take the money back with interest, and in its worst case, like I said, being put on an orange nightie and going to prison and paying back all kinds of money. So it can be very serious. Fortunately, knock on wood, I've never been exposed to that kind of thing, but you never know, and so we have to be on guard for that. Okay, so what's your role in this, you may ask? Well, really, we all play a part in this, just to keep an eye and make sure we're doing the best we can with how we process patients and we document patients' care, and we submit claims and we accept payments. So if we do come across something, the worst thing you can do is not say anything. The best thing you can do at a minimum is at least go to your manager and say, hey, I've got a concern about this. Something just doesn't seem right. And go to your manager. Your manager is responsible for taking it to the compliance officer or taking it to the member of the compliance committee in your division and asking the question. So if you're not sure, ask. That's what we're here for. Third is, again, your duty to follow the code of conduct. You know, the code of conduct, I call it the 8 commandments, really is our way to be sure that everybody's on the same page about our expectations as a company, because it's not just about protecting the money, it's how we want to behave as a company. We want all the divisions in MHA to be seen as a company of integrity that really strives to do the right thing and comply with what we need to comply with. We have an audience participation question, Dawn. Did I do it correctly?
You did.
Okay, so question number 1, our compliance, publish? Oh, I got to publish it, thank you. Publish. Our compliance officer is the managing partner of your division, Colleen Manmore, spelled incorrectly, president of MHA. I can't believe you did that. Okay, it was me. Sorry, Dr.
I
Manmore.
thought it was on purpose.
Chris Terabasi, or Senior Winches. And for anybody over 50, you know who Senior Winches is. I'm looking around this audience and think, okay, there's one of us. If you don't know who Senior Winches is, you should look it up on YouTube. He's funny. Anyways, so please, this is the time to vote. Whoa, look at the votes coming in. Okay, audience participation. What's your vote?
C.
C
for Chris.
C, and they are absolutely correct. Although, thank you, whoever voted there.
They waited.
So yes, Chris Terabasi. So one of the responsibilities within the compliance plan is to name the individual through which all this stuff needs to be accounted for. So, and I take it very seriously. You know, I kind of try to be funny at times, but it is a very serious thing. And if whatever came to pass where we had an issue that needed to be investigated, yours truly would take responsibility for doing that thing or doing that. So what does Medicaid expect from us? It expects us to train newbies, new employees, and to train everyone over again each year. And in order to, one thing the state did do is they did help us by providing this thing called the 8 Elements Compliance Plan. So that's what we have implemented, the 8 element program. So we're going to go through that with some pace. Again, I don't see any questions yet, but feel free to ask them if you have them. So element number 1, policies and procedures. We sure do have policies and procedures. And here is the most recent book, just updated. Every year we go through it and update it. We'll go through it page by page now, only kidding. But each division will receive at least one of these books for your office. So it is published for you, and it will be available electronically as well. So MHA's policy is to comply with all the laws. That's a stated obligation. We're going to exercise due diligence, prevent and detect criminal conduct. So we're going to keep an eye on ourselves. We're not going to tolerate illegal, improper, or unethical behavior, and we will have a process to investigate issues that and by yours truly, with support from the divisions and the management. Element number 2 is oversight responsibility. As I mentioned, it's important that you guys all know that we do have a compliance officer, we do have a compliance plan, and that we do have a culture that encourages ethical conduct. We do have an open door policy. My policy is the door is always open unless it's closed. And Kathy Vero like that one. And at least once a year, the committee, we do have a compliance committee, which is a representative from each of the divisions, and we do get together at least 3 times a year, more like 4 times a year, to review stuff. If we have any compliance issues that we need to be made aware of, so that they're aware, and ultimately we make a report to the board each year at our annual meeting with regards to any incidents that may have come up the year before. Element number 3, while we're here, we're training and educating. We're going to continue to do this once a year at least. We can do that via these face-to-face webinars, face-to-face meetings, or whatever it takes in order to convey the message of how important this is. So again, all new employees sit with the CEO or with Dawn to review the program. They see a video, they'll see this video, and they have the opportunity to ask any questions if they'd like. Element number 4, communication and reporting. Once again, the open door policy. We'd like to keep our lines of communication open. You can always email me directly if you have a question, if you want confidence. You can rest assured that these inquiries would be kept confidential. If it ever goes down far enough and we need to have a full-blown investigation where we think there might be some criminal activity going on, we'll do our best to keep your name confidential, but at some point it may come out. We just don't know. But the most important thing is to know that you can communicate with the compliance officer directly if you feel the need. Audience participation. I can't say that word. Participation number 2. Publish. Which compliance mishap could be implicated by changing a diagnosis code because a patient called and insisted it be changed so it would be covered by insurance? Anybody want to take a guess at that in the real world land?
It's fraud.
Oh, I said real world. I guess that counts. What was the answer?
Fraud.
Fraud is correct. Yes, that could be if you are aware. Thank you. Yes, very well done. If you are aware that what you're doing is wrong and you do it anyways, it could come back to bite us, our company, and say that we fraudulently. So we have to be on guard, and you've all experienced, especially in the front desk area or the billing office, you've all, at one point at least in your life, experienced a patient who insisted that a diagnosis was incorrect, you needed to change it. And so what do? Do you do it? Do you conform to requests? No, you go get help. You should never feel compelled to make a change because a patient insists. What you should do is be nice to the person and say, hey, I understand what you're looking for. I understand what you're asking me for. This is what I'm going to do. I'm going to take your name and number. I'm going to hang up the phone. I'm going to get help, and I'm going to get back to you. There's no reason why to be, hey, our policy is we don't do fraud, so hang up the phone. No, we're going to be nice about it, but we're going to take control of the situation appropriately and go get help. Okay, so that's what you need to do. Okay, element number 5, and Paul, thank you. Element number 5, disciplinary policies and procedures. Corrective or disciplinary action will be taken. So, discipline, yes. If we need to, we will do everything from turn you over to the police or the troopers, whatever. But more important than anything, if we come across something that we think needs correction, it's upon us as a company and upon us as managers to pull you aside and say, Kathy Vero, what we need you to do, she's right across from me. I have to do it. Sorry. We need you to be more careful about the diagnosis code you select in order to justify this patient payment. And so we need to educate. That's what we need to do far more often than not. Aren't you glad you sat there?
I am.
You're very good. And for a year, people are going to be hearing me say that to you. So again, if we'll do what we need to do in order to correct the situation, unfortunately, much more often than not, it's re-education. Right, next. Be simple. Thank you. Okay, number 6, risk areas. One of the things we're obliged to do, and we do this, we just did this literally in October with the compliance committee. I said, okay, we got to talk again about what we think our most likely risk areas are. And our areas that we came up with: billing for items and services not documented, lack of integrity in computer systems. That refers to MEDICAID. Are we using the MEDICAID program properly? Confidentiality of information and records, and that sort of ties into the HIPAA thing. We always have to be on guard that we're releasing records, and that's why we bug the heck out of you to make sure your HIPAA forms are proper and you follow them in the offices. Failure to properly use modifiers, and we've experienced when a payer doesn't like what we're doing. And then discounts and professional courtesy. We just have to be careful that we just don't write off balances just because we like the person. We have to have a bona fide reason why we give discounts or write off balances. We are prohibited from employing individuals who have been convicted of a criminal offense. And sure enough, within the past year, we did have a convicted felon apply for a position that was picked up on a background check. So we do run background checks, and we also do a monthly review of every employee through an outside agency to check to make sure that there's no sanctions out there from the government. Number 7, monitoring and auditing. We're responsible for being able to audit in the event there's an issue. And if there's an issue from the previous year, we do have to keep track in people's files and so on. And if there's a situation where education is needed, then we're responsible for making sure that's documented and that the retraining has been completed. Last but not least, non-intimidation, non-retaliation. We will not intimidate or retaliate against a clinician or staff person for reporting a potential issue. You're obliged to do it. If you sense there's something wrong, you should ask the question. If it's to the point where it could be just a simple, oh, I think, okay, I got it. Well, I think this is the situation, and it settles it, great. If it needs to be dealt in more deeply, dealt with more deeply, we certainly will. And just so you're aware, that will be done with respect. A two-way respect. Audience participation question number 3. How excited are we here? Why is this session mandatory, Chris? Publish. Because Kathy and Chris say it is.
You spelled your name wrong, no.
Whose name did I say wrong?
Kathy is Kathy.
It's not that Kathy.
Oh.
Because protecting my providers and did I know she was going to be sitting here? Because protecting my providers and myself is important. Because protecting the New York State Medicaid program is important. The Kathy in item A is Kathy Hochul, our governor. What is your answer? All of the above. Thank you. That was before the audience here. So you got it right, correct. That is correct, because it's law, and we do have to protect. We do have an obligation, silliness aside, we do have an obligation to protect ourselves, including yourself, including our company, including our patients. Well, attestation, annual code of conduct. So at some point, you will receive a code of conduct. Please print your name and sign it, because no one can read your writing when you sign it. So please print your name and give it to your super duper supervisor. She will forward it to Miss Dawn. If we don't have that document in hand, guess what? Dawn will be bugging you to get it. So please do it right away. And anybody have any questions? Please feel free. Do we have any questions? We'll give you a count of 5, 4, 3, 2, 1. No questions? Audience, any questions? I'm checking the chat box.
No.
Nothing. Well, with that, folks, I really appreciate your time and your energy to pay attention to this. And I wish you all the best. Have a great holiday if I don't talk to you. Bye. Yes.